the legislature and the executive branch have been very active on these topics in the last couple of years. And so and I hope you'll share this slide deck with the rest of the legislature, and I hope I'll have a chance to testify at other places where we get a bigger audience. So starting in 23, legislature sent all the regulation of hemp-derived cannabinoids to DPH, and then over 24 and 25 made numerous changes related to vapes, cigarettes, nicotine, and also cannabinoid beverages. So it's been shifting a lot in the last few years. In 23, we were directed specifically to regulate the hemp-derived cannabinoids. We have had 2.5 years of continuous regulation. Unlike alcohol and nicotine products, there are no FDA oversight for these things. There are no national standards. This is boutique work that varies specifically from state to state. We had to build from ground zero an entire infrastructure, a whole new team with new competencies that nowhere in state government did that exist. And we've been doing that. So we were told to immediately begin regulating hemp-derived cannabinoids. That Bill 544 had an effective date July of 23. 1 month later, we put our first emergency regulation out, and we worked for 2.5 solid years. And that's why I put all this in here. There have been legislative hearings for reg review, and other laws throughout this 2.5 years. The most recent and last regulation we needed, the biggest one in some ways for the retail space, was just approved in February of this year. So 7.5 or 8 months ago. So a lot of work. So what have we done? So the products, all the intoxicating products for hemp-derived cannabinoids now have to be regulated. All unregistered products will be prohibited from sale. We do all this information gathering for the businesses to ensure we know who we're regulating and that we have tabs on it. And there's mandatory third-party testing. One of the problems is you don't know what you're buying. So you have to know that at least what's on the label accurately represents what's in the container. So we're doing a lot of those things and making sure the solvents and all the other stuff that's not supposed to be in there are tested and not in there. In the retail space, we do all of this stuff. We prohibit intoxicating sale to minors, prohibit plant material sales. There's other laws for that. We have labeling requirements, child-resistant packaging, consumer warnings, testing limits, record keeping, and you can't just put all this stuff in food in the state without following specific regulations, because people would go and get thoroughly baked at a multi-course meal with people putting all this stuff in there. And I think the legislature's been very concerned about this, appropriately so. For retail inspections, look, we're not wanting to be hostile to businesses. We want to educate them first and give them the chance to come into compliance. So we lead with education since all of this is new, but we also enforce when there's non-compliance or they're in violation. So for the retail sites, we collect all this type of information, verify the stuff on the shelf fulfills the labeling requirements, and they can only sell registered products. We've done so much work on this that just this February, the National Cannabis Industry Association said, quote, Kentucky's hemp program stands out as a model of safety, transparency, and innovation due to its prioritization of registration and rigorous testing of hemp products, and it goes on. We worked with industry, and industry has sat at this very same table with me and complimented the work we've done because we worked in partnership, but we have also put in very significant standards to try to protect people in Kentucky. So here's what we've done. Just since February, March of this year, we've reviewed over 1,200 submitted product registrations. We have only approved 30%. We have denied half of them for failing to comply with these requirements. So we are beginning now, just the beginning, it's the tip of the iceberg, beginning to apply standards, and we've still got 20% of these almost that we have to still review. Look at how big this industry is. I estimated there could be a couple thousands. We're right there. There's already almost 2,000 retail sites permitted to do this stuff, and we still get 40 or more new permits each year. I'm almost done here. So we've done enforcement too. We've inspected at this point, because this was through September 30th, more than 500 retail sites. We've embargoed, meaning we've cordoned off and said you may not sell this. It has to be removed from the floor and returned to your distributor or destroyed. 191 different products. We've issued cease orders. We've suspended a permit. We've even gone to court on one who would refuse to comply and got an injunction against them. And in some instances, we partner with local law enforcement when there's an immediate need to seize and destroy product. And so we've been very active in this, and this is just about 6 to 7 months worth of work, folks. So the work that is wanted is being done by a specialized team that didn't exist and had to be built. And you remember that 544, it was the Kratom, which I'm getting to right now here, that was on the list of one of the things we did not have an appropriation for to do. We now have a team, we have retail permit fees, we have now identified the revenue source. Each of those sites has to pay a retail permit fee, and so we are now in a place where we have a structure and a framework already built for hemp-derived cannabinoids, and we have a revenue source, and so now we are able to start doing this work on Kratom because those things work together. It's the same team, same skill set. So Kratom itself is an unregulated herbal substance from Southeast Asia. It has opioid-like effect, and in fact, under Kentucky law, it actually qualifies as an opioid. Kratom has two main chemicals, metragenine and 7-hydroxymetragenine. The one that gets the most attention is 7-OH, 7-hydroxymetragenine. It is wicked potent, ultra-concentrated, addictive, creates withdrawal symptoms, neonatal abstinence syndrome. All sorts of bad stuff happens with that. The 7-OH is way more potent. It's present in the natural plant, but only in scant quantities. This is just like the hemp-derived cannabinoid stuff. Organic chemists or kitchen chemists, bathtub chemists, synthesize this stuff, or they hyperconcentrate it, and they make it wicked strong, and it causes bad stuff to happen to folks. It is not approved by the FDA. Dr. Marty Makary, who I just saw in D.C. yesterday, has been on the record along with others about this stuff needs to be regulated and overseen. In 7 or more states, it's been outright made illegal. Kratom and all of it. And so this is an area where there's a real need for specialized team and expertise to do this work. Both the FDA and the Drug Enforcement Agency have issued public cautions on Kratom, and we were given legislatively earlier this year an encouragement for the Office of Drug Control Policy and Department for Public Health to issue a public awareness statement about the dangers of 7-OH and Kratom, which we did. Now there's a tension here because the natural, if you will, the natural Kratom community doesn't want these prohibitions because they say natural Kratom's not as dangerous, but I refuse as a physician and in my health role to give the false assurance that any of it is safe when none of it is regulated and no one has any idea what they're getting. But they are absolutely correct. 7-OH is far more dangerous than people using the natural plant. So we're almost done here. So in 2024, House Bill 293 assigned Kratom regulation to the Department for Public Health. It already prohibits sale to people under 21, and it already has limits on 7-OH content. We just created this drug and supplement branch. We're doing all this work with the hemp-derived cannabinoids. We have built a coherent regulatory framework that has had industry support to be rigorous and aggressive about making sure that we regulate these things. We are now ready and poised to be able to do the Kratom version of that and have the same permit fee for retail, allow people to sell multiple substances, but all be overseen by that same team. So again, we're not trying to be punitive to industry, but we are trying to protect Kentuckians and follow the intent that the legislature has given in law. I guess if I had to leave here with one ask, and this is the final slide, we're doing the work that the legislature wants. And I would ask those of you who are still here to encourage your colleagues to watch this video and to communicate with each other and share the slide deck. My biggest concern is there's not enough shared understanding, so we're not on the same page. And so these different committees create different bills, and then we start pulling different directions. We're doing the work, and we're poised now to ramp up. And I think that we can all, this is an area where executive branch and legislative branch, we're aligned in what we want to do to promote safety and protect the public. And I hope this gives you some assurance that a lot of work has been done over the last few years, but we had to first build a whole new framework from scratch, get a revenue source, and now move forward. So now we're at the phase where we're going to scale and make it better. And the last thing is the new public health lab that we're designing now and we'll break ground on, we hope, next summer. We're building a dedicated laboratory in there so we can spot test ourselves some of these contents if we take it off the shelf. So Representative, that's the end of this report.